Hello, welcome to the second Fixarunner podcast with me, Sam, and
George.
George. We're here. We got a bit of a question and answer bit going. We've had a bit of a chat about our week, what we've been up to. Yeah, should be another good little chat. Don't forget to like, subscribe. We're on Instagram, we're on Facebook at Fixarunner. But yeah, have a listen, sign on, emails in, so we can start pestering you. No, don't use that.
Episode 2, who knew, eh?
Episode 2. Running out of material yet?
Yeah. Of course not.
So tell us a bit about your week, mate. How's it been?
Yeah, it's good. Working full-time NHS at the minute, which has its own challenges, but it's good to see a lot of different things through the door. Saying to you just before we started recording, it can be a little bit fatiguing, but I guess that's like anything, isn't it? And I've actually, you're not going to believe this,
What?
I've got another running injury.
Another one?
So,
this isn't a good look.
yeah,
So this is training for Berlin now.
training for Berlin, for anyone who was watching before. I am now week 2 into the training.
Yeah.
And
when is it? How long have we got?
15 weeks.
Okay.
Now, so I've got way more time.
Plenty of time.
So it'll be fine. I just need to tailor it off. I'm going to reduce some impact. I've got shin splints, so a bit of time on the bike. That's a couple of weeks.
A bit of time on the bike.
I think so.
I like that. Bit of cross training.
I've been trying to keep running, but I think I've just been it's just the impact struggling with it. Just reduce the load.
Sounds like you need to recover.
Yeah. Put it into practice.
So not so much running recently, then a bit more on the bike.
I did run last night. I did a 10k.
Yeah.
And this morning it was just
not good.
Not good.
Oh, well, 15 weeks. You've got plenty of time.
Plenty of time.
Yeah, good.
We'll see if this works.
Yeah, it does.
It does. It worked for the foot. It worked for the foot. So.
Exactly. Yeah, no, I've had a good week, busy week, just readjusting after some holidays and stuff. So, yeah, I've just been back on it, got into the swing, been to some runs. Did a nice 7k with my 6-year-old on his bike, which was good, just around town. And then I did some hill sprints yesterday, just trying to get ready for some hockey. And obviously some running, but yeah, for hockey. And then did a little weight session this morning. A few deadlifts in there, so yeah, I feel like I'm back, ready to go. Yeah, so it's been a good week. It's been exciting, and looking forward to this as well. Looking forward to get chatting. Right, so what we're going to do is we've got some questions. We're going to take it in turns to answer them, hopefully well. So George, you want to go first, or shall I ask you one first?
Yeah, no, absolutely.
So we got a question that came in. So how does online injury rehab actually work? Don't I need to be seen in person?
Yeah, so the way Fixarunner is going to work, for anyone really interested, we've recently put out a few new packages, which we'll probably dig into a little bit for now. But the way this works is we'll do a one-to-one call with you to unpick all of your, the issue or the injury that you've been having. It'll probably be a questionnaire that you'll do first, so we can really unpick things in the call, and from there we can kind of set out the whole rehab program. So from that initial call, you'll kind of have a diagnosis, and then you'll have takeaways which will be instantly actionable with a plan going forwards. Being online, we've got an app that we use to do all of our rehab exercises on. So we're going to check in through the app, and the different packages. You might also have access to messaging us on WhatsApp as well.
Yeah. So basically, what is it about running injuries that means that we don't have to see someone in person? Why running injuries in particular, I reckon, is a good question.
Yeah, I think we thought running injuries specifically would be most applicable to an online format, right? Because of the way that we can manage load.
Exactly.
It's very load management heavy of rehab from a running injury. Which we spoke about in our the last podcast. So no, I didn't. Check that out.
Yeah.
I think online running injuries are, it's manageable online because we can manage load, but you can still get the exercises. But it's easy for us to kind of rule out other injuries as well, or other issues. I think from a discussion,
the diagnosis is a bit easier with running injuries. Like they're fairly clear cut. I think you can kind of do that bit of detective work to work out what's actually happened, why it's gone wrong, and it's just much easier to tweak. Much less reliant upon hands-on treatment. I feel, like we said before, like I'm very hands-on day to day, but like with running injuries, it's much more rehab based, and it's much easier to diagnose from afar and rehab from afar. From afar.
From afar.
Yeah.
Yeah.
No, right. Next question.
All right. Next question. I'll ask you one then.
Yeah.
So another question we've had, general question about the service is: I'm not sure if my injury is serious or just a niggle. Can you still help?
Yeah, so good question, and it's a really tricky one to decide anyway. Lots of people get niggles and aches and pains for varying amounts of time, and it's hard to know when to act, when to stop doing what you're doing, when to look for help. I think generally speaking, we can obviously help with all of it. If it's just a niggle, it's going to get better anyway. So
Yeah.
there's plenty of advice we can give around getting a niggle better. Time, I think, is the main concept we're looking at, really. Severity as well, but particularly time. I think if you've had a run, you've had pain during or after, and it's lasted more than 24 hours, then you need to look at how you're managing it. I think if it's lasting more than 3 days, and particularly if it's there at the start of your next run and into your next run earlier than previously, then potentially you've got a bit more of an issue that might need some looking at. And again, with our service, because it's online, it's quick, and we can diagnose it quickly, we can get the rehab to you hopefully within a day or two, and make sure you're managing it properly from as early as possible so that it doesn't turn into something more serious.
Yeah, that's great. I think if you're just seeing this, we've got so much advice on our pages that if you're unsure, you can have a look through certain injuries, and if you think actually you need a little bit more help,
yeah, it's all on there for free.
It's all on there for free, giving it away.
Right, next one.
Yeah, that's great.
Yeah, so we've kind of covered this already, but do I need a diagnosis before I start? Can you help me figure that out?
Yeah. So part of our process, that initial phase, as what I've already said, is figuring out what's happened.
Yeah.
So unpicking the injury, how long you've been having it for, how it happened, how it's developed, what you've done for it so far. I think those first couple of questions, we'd already have an idea of what's going on.
Yeah.
And then we can kind of unpick it through that one-to-one call after you've done that questionnaire.
Yeah.
So actually, you don't need to have a diagnosis before. No, we can help you kind of narrow that down, and that's what we're here for.
I think that's, sorry to interrupt, but as myself as an osteopath and George as a physiotherapist, our strengths are diagnosis. Like one of our big things, and I think what sets us apart from some other professionals is that our ability to diagnose quickly and accurately, I think, is really important. So yeah, I think absolutely we can help you diagnose something before you start. Sometimes it's like a working diagnosis that you kind of tweak as you go along. There are thousands of exercises, thousands of rehab things, and it's trying to pick the best ones to start with and then make sure that we're there to tweak it as we need to, which again, through the app that we use, there's that constant feedback that we can tweak it as we need to.
Yeah.
If we're not sure it's kind of 100% right.
Yeah, absolutely. But absolutely. But the way we've set up, the questionnaire, our one-to-one initial meeting, the diagnosis will be pretty clear, especially in running injuries. I think we're both quite confident in that. And
definitely.
The way of, what's aggravating your injury, where is the injury as well, to start with.
Yeah, that helps.
But yeah, no aggravating factors, what eases it, and the pattern to it. And picking that really gives us a really good, strong chance of getting a diagnosis pretty nail on the head.
Perfect. Right. Next one. So we've kind of been through the next one, haven't we? How do you assess someone without touching them? So again, it's more about the diagnosis and finding that diagnosis and working through a rehab plan. You don't need to touch someone to do that. There might be cases where in our kind of one-to-one chat with you that we might need to see some movements on the screen, but again, that's going to be probably a rarity, to be honest. Most of it we're going to get from your kind of history and the knowledge you're giving us in terms of the injury, rather than what you can do in front of us, whether you can stand on one leg or two.
I agree. I think a lot of the stuff as well, I quite like challenging certain movements. So even if it's a case of stepping back from the camera, looking at you on one leg, doing some hill raises, again, that gives us a really clear.
And then right, so again, it's more about the online format again, really. So is it video based, or do I get a written plan to follow?
So the app that we've got is really, really good. So you get videos of each exercise. I don't know if you'll be better to explain it because you've been using it for a bit longer.
Yeah, so you get videos of the exercises that we've selected for you. So it's not just like a run of the mill, oh, here's an Achilles problem, send.
Yeah.
Like it's personalised to you and based on where you are with your injury. So you get videos, you get sets and reps. Sometimes it's as simple as, right, you need to do this every day or 3 times a week or 4 times a week. Sometimes we can tweak it so that every day you're doing something different. In that as well, we can put in some running. If you're still running with an injury, we can put in running as an exercise and tell you how far to do or how long to run for. And we can literally program 7 days differently if we want to, week on week, or like I said, if it's sometimes, most of the time, it should be simple enough to go, right, here are your 4 exercises, 5 exercises, do these every other day or every day, and then after a couple of weeks progress it and keep going from there.
Yeah, and like you say, it's going to be so dependent on where everybody is on their individual journey, because we can be hitting really complex exercises or end stage stuff straight off from the off. Actually, we might need to tailor it off and say, actually, we need to take time out of running or do some less impact, or we can be, like you say, scheduling runs in and trying to weave the rehab back into your training program and get you back on track.
Yeah,
definitely.
Right, next one.
What kind of support do I get? Is it just a one-off session or ongoing?
Yeah, so very much ongoing. As Georgia said on the website now, we've just changed things slightly to offer a core package in terms of what people are going to get. And the basic idea is that we have a one-off session in terms of to diagnose it, to have that initial chat. We'll have a second session potentially after 2 or 4 weeks of rehab to see how you're getting on. But within that time, we've got the ongoing support through the app, through WhatsApp, so that we can make sure that, daily, weekly, monthly, that you're happy with where you're going. And if you've got any questions, it's straight to us. So it's certainly not a one-off thing. I think the initial core plan is an 8-week thing. I think the max plan is a 12-week thing, which should give us, plenty of time to rehab something back to a really good level of activity.
Yeah. As Sam said, we're now offering a kind of max plan, which is going to be up to a 12-week all-inclusive package where you're going to get gait analysis, you're going to have one-to-one calls, seeing all of the access to the rehab app. You've got access to us on WhatsApp, so we can check in with you almost weekly. So definitely go and check on the website if you feel like you're stuck in the woods at the minute. That plan will be that start to finish product.
Definitely get you back running.
That fast, should say. Yeah, it's fast track.
Cool. So another one here. Oh yeah, I mean, an absolute classic one that we get asked all the time. I'd probably say it's the most common question I get asked from runners is, can I keep running whilst doing my rehab? Over to you, George.
Yeah, so I think probably as we've already touched on, it is kind of case to case dependent. For anyone that was watching before, when I had my foot injury, I was still running. I just had to completely tailor it.
Yeah.
So it's going to depend on everybody individually. So yes, we can keep you running, is the bottom line. It just might be a slight change to the intensity, the volume, the frequency in the average week.
And you're very rarely going to be trying to build. Like if you're working on a training plan and working towards a race, you're not going to be trying to keep progressing the mileage or keep progressing the pace whilst you've got an injury. It's going to be a slightly different look to your training. Yeah. But yeah, the aim's got to be to try and keep someone running whilst they are, if they can.
Yeah. And that's what we'll work with you to do.
Definitely. Right, next one.
So, Sam, next one question's for you.
Yeah.
Do you only help with injuries, or can I use the service for prevention too?
Yeah, so a really good question. And again, it's a question when me and George were setting this up, is one of the things we kind of questioned ourselves was, what was this for? And certainly at the minute, we are an injury advice service. So we're going to stay away from the injury prevention plans at the minute. I think that kind of strength and conditioning world is one that is fascinating and complicated, and is one that we don't feel like we want to go near at the minute. Yeah, I think again it was a discussion we had because we want to try and offer as much as we possibly can to as many runners as possible, but our expertise at the minute are certainly within injuries and injury advice. And look, there's again, have a look on socials because there's plenty of injury prevention tips. And we'll hopefully we want to get married together. We're going to put an injury prevention ebook out there. So there's some of the free services we're offering are around tips to try and stay running injury free, and that injury prevention side of it. But in terms of the service we're offering, it's very much aimed at injuries.
Yeah, for now.
Yeah, watch the space.
Yeah, no, that's good.
Right. What kind of injuries do you deal with the most? Knees, hip, feet, etc. Question mark.
I think personally, I see more knees.
Yeah. Well, running.
Yeah. Running knees.
Like runner's knee or ITB or
Lots of runner's knee, like pain at the front of your knee and in your kneecap or in your tendon in your knee.
Yeah.
I've had quite a few twisty injuries as well. People that have actually like fallen over and twisted when running, and then had a bit of a flare up of pain on the outside of the knee. But for me, I'd say I'm dealing more with knees.
Yeah.
It's not to say I don't deal with hips or feet injuries.
We got a foot injury yourself.
A lot of experience of that.
So for me, it's slightly different. I'd say Achilles. I deal with a lot of Achilles injuries, and a bit of plantar fasciitis, and some shin splint pain as well. I hate the term shin splints, but some kind of medial tibial stress syndrome, tibant stuff. Get all the fancy terms in there. But yeah, I would say more lower limb than knee. I tend to. I don't know if that's just the demographic around here. I wonder if I see more distance. Like there's a lot of people doing ultramarathon stuff at the minute. I wonder if that is more Achilles type issue that I see than maybe something more kind of pace related, like maybe a knee is.
Yeah,
is that fair to say?
Not sure. I think it's just that just goes through swings and roundabouts at the minute.
Plenty of knees. But yeah, we can help with anything. Like, there's plenty of lower back, hip related things that runners have. You don't often get shoulder pain in running, but maybe if you're running with a rucksack or if you're running your gait's not quite right, you can. But mainly lower limb.
So one of the things we were speaking about before, touching on your last point, was I think we wanted to put it on the website somewhere or say if you were to come to us and actually we're not the right people at the right time.
Yeah.
I think we want to be honest. I think we really want to be honest with that and say signpost you to the right place. And we've had all this experience, and I think working in the NHS or working in your position here, it's something that's not. It's rare, but it's not
uncommon to us.
Yeah, it's not uncommon. In that instance, how would we manage that? If we had someone come onto the call, actually, it's something that we're not able to deal with. I can't give an example off my head, but they came in with some sort of running injury. It just seems a little bit off. And how would we go through that?
Yeah, so it's like, again, because of the experience and knowledge we've got, it's about referring you on to the right people, and that might be to be seen face to face. That might be to see a GP. It might be to go down a different route. And like George says, one of our roles as therapists is to make sure we know where our limits are and to be realistic and manage patient expectation. And I think, again, it's something I think we're both very good at in terms of, you'd hope that everyone that comes through we're going to be able to help, but the reality of that isn't going to happen. And there's going to be some people that we can't help. And if we address that early and then make sure they're seeing the right people and going down the right route, then I feel like we've done our job in terms of directing that person. Fair enough. I had a patient in clinic today actually who, I've treated a couple of times and it's just nowhere near where we need it to be. I had that difficult conversation where I was like, look, you know what? I'm not here to take your money for not improving you. We need to work out why not. And so I've sent a letter to his doctor. He's gone to see his GP, and it will go from there. And I said to him as he went out, don't lose that communication because I'm here to help. And the main thing is to make sure that we do right by the patient or by the runner, and that's really important.
I think that's something that's going to work quite well for Fixarunner is if we do have someone that needs to be managed elsewhere, especially if they come down our package route, it's still something that you can come back to. You can almost put it on pause, like it's not a membership, but like a membership, if you say it's not right for you at the time, you get the other issues seen to, and then once it's time, we can pick back up where we left off.
And sometimes it might just be confirming that an injury isn't as serious as it could be.
Yeah.
So it might just be, for example, like if we're worried about someone having a fifth met fracture, like we're going to need an X-ray. We can't do that. We're going to refer someone on to get an X-ray on it, and then if that then proves to be not a fracture and doesn't have to be managed a certain way, then you can come back and we can manage it the right way. So it's about making sure we do right by the patient.
Yeah, and that's part of the initial consult, right? We're going to work out what the injury is, and we'll be able to work out if actually this needs to be managed elsewhere. But
yes. And that's, to be honest, the next question is about someone that's already seen someone and it didn't help. What makes us different? And I think, again, we've got to do right by the patient, and our expertise and knowledge hopefully sets us apart from some people. But equally, it's about that reassurance, that patient expectation management, to make sure we know in what direction we're going. I think we said it before about kind of cutting through the noise, simplifying everything down, making things easy to understand, and making sure we've got like a step-by-step plan to work off. The way we've worked this through is that there is that it's an easy thing for us to put in place, those little steps, to make sure we're building in the right way. And the beauty of not having to go anywhere, like face to face, to see anyone to get that advice, the fact that they can do that online, via the app, via WhatsApp, and get that constant feedback going is hopefully going to be really helpful. Or it's really helpful.
Yeah, absolutely.
Right. So another one for you, George. Is it suitable for beginners like yourself or serious runners like myself?
Hang on a sec. Sorry. I said Wi-Fi disconnected. Still going? Let's just continue. So, sorry, Sam, what was that question?
So, you missed my cheekiness. Where am I? So, is this suitable for beginners like yourself or serious runners like me?
Yeah. I was thinking about this when I saw the question, because I feel like I wasn't really. I think it works for everybody. I don't see why it's not gonna. I feel like there's some of the stuff that we're putting out might be on special nutrition. It might be more beginners friendly, and that's why I kind of hesitated with that. But I think we've been working in this area for quite a long time. We've seen a lot of physio runners, in person of all levels. So actually, we're here to get for you to be seen by the right people, which we feel like is us, so we can either direct you or we can manage you through our program, whether you're a beginner, intermediate, or you're pushing for you're a serious runner.
So final question, do you ever refer people to local in-person physio or osteopaths? So again, it completely comes down to what we were saying before in terms of making sure the guidance we're giving is relevant to the patient. And if we feel early on that there's a need for a face-to-face or hands-on treatment, then yeah, absolutely. Both between us, we've got a big network of osteopaths and physios around the country that we know, and we'd always look to try and refer on to someone that we know. But equally, there's plenty of good osteopaths, physios, chiropractors, whatever they are out there, sports therapists out there that will do a good job. So absolutely. If we think it's necessary, then yeah. But again, as we touched on earlier, one of the reasons we've gone down this running injuries route, aside from our passion for running, is the fact that running injuries are particularly good at not face-to-face rehab.
Yeah. And like you say, we're here to be honest, right? We're here to say we know what our limits are.
And then the last one, I'm gonna sneak this in on George, so you can't see this one. So I was just having a look around about common running questions on Google. So if you're a runner and you're having a little Google around, what do you think the most frequently asked questions to Google is about running?
Just generally about running.
You'll kick yourself at the first two. So what?
First one.
Yeah, go on.
How to run fast.
How to run fast.
Or like how to run faster.
No, it's not there.
It's not even there. It's not even there. So like five.
One's like 5. Top 6.
Something about shoes. Shoes is the most searched for thing about running shoes. The most, searched for things, and the second one is about specifically men's or women's running shoes.
But in terms of questions, so if you're a runner and you've got friends that aren't runners, what would you say the biggest thing they would say if to you as a runner?
What they ask?
What would they?
have a question about this. Someone that's trying to get into it,
Right.
and they were just like, every time I go for a run, it just sucks. Like,
Right.
just like I can't breathe.
Yeah.
I can only run for so long, and I just can't get into any kind of rhythm. It just sucks. I feel like my heart rate's always up.
Yeah.
Basically. So the advice I give to that person, advice I gave to that person,
Yeah.
I think we made a video about it, is literally just slow down.
Yeah.
Like, stop putting the pressure on. Stop looking at your watch. It's so easy to go straight out and try to go for a time, but actually the first step getting into running is just kind of getting out and doing it, and getting around it, maintaining a certain pace. Everyone will say being consistent, right? So you're running at consistent pace, even doesn't matter what pace that is for you.
Yeah. So you nearly got number 4 was, which is how to breathe while running.
Yeah.
So you kind of said about feeling a bit breathless.
Yeah.
But the one I laughed at is number 2. So I'll give you number 2. Is running bad for your knees?
Ooh.
And again, I don't know if you've had this, but the amount of patients that come in to me and they get so annoyed as a runner that people think it's the running that's causing everything.
Yeah.
Yeah. And
basically, is upset.
Yeah.
You should,
you shouldn't do it. It's bad for you.
A family member of mine, recently got diagnosed with osteoarthritis in his knee.
Yeah.
And he had done quite a bit of running in the lead up to that.
Yeah.
And a few of my friends are kind of saying at the side, like, "Oh, it's the running that's done all that. It's worn out his knees."
Yeah, I mean, even looking at the research, like there's a I can't remember how long ago the research was out, within the last 5 years. There's obviously it's different person to person, but there's a sweet spot. So too little running isn't very good for you, and too much running is potentially not very good for you. But what's too little and too much for each individual person is the question. Yeah. But generally, running isn't bad for your knees as long as you do it in the right way.
Yeah, no, I read something somewhere that you're not going to necessarily get cartilage damage from running, or wear and tear just from running. That's not saying, like, if you were to twist your knee and hurt yourself and get like a traumatic knee injury, because it's slightly cause damage. But just the actual running itself isn't going to wear out your knees.
Shouldn't do. So it kind of leads to the first most Googled question is running good for you?
Hey, okay.
So is running good for you? Is running bad for your knees? Number 3, and I'm going to get you to answer this one, please, if that's all right. Good luck. Is how to warm up for a run.
Okay. Yeah.
I've caught you off guard.
Diving in. No. You'll probably read all over the internet that they'd want something that gets your heart rate up, actually. Dynamic stretching, which basically means you're not just diving into a stretch and holding it as hard as you can. You're doing movement. So lots of people will see, like, shoeing the pigeons or shoeing the chickens. So you're doing the hamstring stretch. We'll start some other dynamic stretches.
So I
gait.
I like lunges.
Lunges, really good. Squats. Personally, before I go through one, I go through a rhythm of squats, lunges. I do quite a few kind of just hill raises, static hill raises, and then I start to progress into like hopping on the spot, and then jogging, and then when I start slow, get your heart rate up, and then you're kind of into the session.
I think that's the main thing for most people is just to start slow.
Yeah.
The more functional you can make a warm up, the better. Yeah. And the only way of making running functional is to run just a little bit slower. And I think that's essentially what you try and get people to do. Again, the other thing with warm ups, again, looking at some of the research from a few years back, was that the only problems came when the warm up was changed. So if you've got something that works for you, don't change it. If it's working, brilliant. If it's not working, and there's if you don't feel particularly lively early on, or you've had a particularly long day sat at the office, then you might have to do a bit more. Like generally, if it's working for you, like don't change it.
Yeah.
And then the other thing I'd say is, and something I talk about a lot, is like transitions between like parts of your day. And I think a warm up is more about taking your body from one state into a running state. And so whether that is, you run first thing in the morning, so going from a state of sleep into a state of running, going from work, whether that be manual, whether that be desk-based, how again do you go from that state into a state where your body's ready to run? And I think that's where all warm-ups, the most important is it's about what you're coming from and what you're then going to go do. And it's going to, again, different people like different things.
Yeah, I think that's a nice answer.
Right, so yeah, I mean, that's it. What causes a stitch?
I did read this. So I think there's a couple of theories, aren't there? There's
I generally don't know.
So say you were to just dive straight into running without a warm up. We're talking about warm ups. If you're just going straight in, your heart rate hasn't caught up with you. Your temperatures are all wrong.
Yeah.
So you're not getting fusion. So you're not getting like oxygen fusion to your oblique muscles. I mean, that's where the stitches are. Yeah. And then I think that's one theory. So then
I just kind of assume it's something to do with your diaphragm.
Yeah, all that. So then your diaphragm isn't warmed up. So then it's not stretching properly. You're taking these massive breaths and stretching your diaphragm.
Bit of research on there, I think.
So yeah, I need to look into that. That's one of the theories that I've read. I don't know if it's true or what.
Oh, that's interesting. And then the final one, sixth one, was how long does it take to run a mile or 5K? I mean, you can't answer that, can you?
It's so dependent.
I mean, I think there was a park run 5K record set, wasn't there, recently?
What's that?
Yeah. I want to say 13 minutes something. Yeah.
Park run as well?
Yeah, properly fast. Yeah.
What was it?
I don't know. Somewhere flat. Yeah, I'm sure. Search for the park run record. Yeah, I mean, Roger Bannister's 4-minute mile. That's been broken a few times now.
Victoria Park, Belfast.
What was it? 13 minutes?
13 minutes.
4 seconds. Yeah, that's rapid, isn't it? It's ridiculous. That's so fast. Yeah, that's really good. Oh, there's one more thing I forgot to say at the start. I took my son, 6-year-old, to his first junior park run.
Oh, no way.
Yeah, it's great. So we basically did interval training because he sprang and then walked and then sprang and walked the whole way around. I think after the first 30 seconds, my heart rate hit 150.
Yeah,
because he just went with everything. But what brilliantly went, it was at Taunton Long Run Meadow, and it was their 10-year anniversary. So they've been in junior park for 10 years there. And I think he took, was it 2K? I think it was like 15 and a half minutes as a 6-year-old. I think the winner, so it's 4 to 14 you can do it. I think the winner did it in about 6.5 minutes, which I thought, I don't know what age they were, but that's pretty quick.
That is pretty quick.
So you should go on a Saturday to the action park.
Yeah. Sprinting round.
Yeah, too right.
Wow.
Right. Any other news, George? Anything else? Right. No, look, there's nothing. Right, let's do some of these hooks, shall we? You're going to be struggling. I'm on straight down my bum. So these will be good. They're caused by you running too much. They're caused by running more than you. Running injuries aren't caused by running too much. Running injuries aren't caused by running too much. They're caused by too. I need one of those videos, like these script things on here.
Yeah,
you can do it. Check out Fixarunner.
Nice.
Good, Dan. Click on that down there.
Oh, super. Early loading is essential to injury rehab.
Yeah.
Oh gosh, what was the? We're doing this is the early load. One of the things we
sign up to our mailing list for regular injury prevention advice, rehab advice, for injury prevention advice, for running rehab advice, and return to running protocols.
There's tons of noise on Instagram, Facebook, and YouTube. Where do you look? If you sign up to our email list today, you'll get daily emails about these essential methods for running rehabilitation and why Fixarunner will work for you.
Cut through the noise with Fixarunner.
Should we start saying stuff?
Right, done.
Should we call it a day?
Yeah.
That's a wrap.
I hope that came up.
Stop.